A Little Rock woman has a new outlook on life tonight after undergoing a complicated heart surgery for two different conditions. Her story is the focus of tonight's Health Check report. Melinda Stephenson is a mom and grandmother who had always been full of life until a few years ago.
I retreated within over the last few years because I just didn't feel like doing anything.
She struggled with exhaustion and shortness of breath.
Anytime there were activities that there was walking involved, I just dreaded because I knew just from my job to my car, I would have to stop a couple of times and take a breath.
Turns out it had everything to do with her heart. Stevenson had two problems: severe aortic stenosis, or a narrowing of the valve opening, and she also had a bicuspid valve. Instead of the normal 3 cusps, she had 2 fused, something she was born with.
When the valve opens, it's supposed to be kind of the size of the opening of a quarter, and for hers was down to the size of about a pencil eraser. Blood flowing out of the main pumping chamber, the left ventricle, going out the aorta, was meeting resistance or obstruction. At the valve was the major problem, but then also had this bulge here so that it was limiting blood flow out into the aorta.
Cardiovascular surgeon Dr. Pouya Hemmati says Stevenson needed a surgical valve replacement and a septal myectomy. That's a complex open heart surgery performed at only a handful of hospitals, including Baptist Health.
Replace the valve and then open up the pathway for it. So it's kind of like opening up that road and then removing the roadblock.
Stevenson says she's thankful for that next level care she received that drastically improved her quality of life.
I look at everything different, that things I can do, things I can look forward to. I'm excited about tomorrow.
And Dr. Hemmati says not all patients with valve issues need the same procedure, but it's important to be seen by a cardiologist if you're experiencing symptoms like fatigue and shortness of breath.